Good evening. We are live here at TMS Roundtable. My name is Dr. Tova Goldfine, and I'm enjoying this Monday night routine with my co-host, Rose Hoy. Good morning down there in Melbourne, Australia.
Oh, good morning, Tova. Thank you all for joining us this morning in Australia and this evening in Europe and afternoon in America.
Yeah.
We've got Dr. Doug Guiffrida. Now, he's a professor at Rochester, which is in New York, I believe, University, and he's going to talk about the fact that TMS is actually a pandemic, as we said. It's all over the world. There's so many people with chronic pain, and we know that it's related to even being held up with the lockdown, and it's exacerbated it. But Dr. Doug is actually a TMS patient from the past, so he's going to give us a little bit of his personal history as well. Welcome, Doug. Thank you for joining us.
Well, thank you. I've been watching. I love some of your shows. I've watched a number of them with people that I really have learned a lot from. So it's an honor to be here talking to you. And I appreciate this as a conversation, not a straight presentation. So it's terrific.
Relaxing. Just take off your tie, sit back, enjoy.
Exactly. Yeah. So, I do want to tell you my story because that's how I got into this. I believe that John Sarno's book and work saved my life, and that's why I do what I do now. So I was a chronic pain patient. In hindsight, my whole life, but it really didn't come to a head until I think it was about 17 years ago. I had debilitating back pain. So bad I couldn't sit down for a year. I would kneel in the back of our SUV when we went places. I'd either stand or lay down when I was working. I also had this little chair that was kind of like you were kneeling, but I couldn't sit, and it was just awful. I got diagnosed with a herniated disc through an MRI, and I tried all kinds of non-traditional stuff first and traditional stuff. So I did a chiropractor. That didn't work. He told me I wasn't going enough, so I went more, and that didn't work. And I tried a different one, and I didn't get help from that. I had physical therapy, same thing, 2 different physical therapists, just months of just trying to work on myself and different stretches and things, and I didn't get any help. I had cortisone shots, 3 of them into my back, which, hurt like hell to get them, but it didn't really help me. I did yoga, I did acupuncture, tried a bunch of different medicines. I'm sure there's more things I'm forgetting. I basically did everything under the sun. And I finally resigned myself to get back surgery. And in the meantime, I found Sarno's book. I found it was Healing Back Pain. I just started reading it. It was the type of book I couldn't put down because I hadn't ever heard anything like it before. And it resonated, the symptoms, the moving around, my whole life having, it was always something. And the personality characteristics, I'm like, oh my God, could this be it? But I thought, no, I have an MRI. I've been diagnosed. There's structure.
Well, he wrote the book for you. Dr. Sarno wrote the book for you.
Oh, it was written right for me. I've never seen something that spoke more clearly directly to me in my life. And so I went to my surgeon for like a pre-op, and I said, is there anything to this? And he goes, oh, you're talking about Sarno, right? I said, yeah. He said, no, there's nothing to it. And I said, but can it hurt to try it? And he said, if you don't mind being in pain, basically, you can try it. And, basically, yes, a lot of my clients or patients have, a lot of personal stuff going around. I don't know, maybe there's something to it, but I can tell you have a herniated disc that we need to operate on. But if you want to try this, you can. And so I did. I started doing the exercises. I found a therapist, not a TMS therapist, but I just found someone who did psychodynamic therapy, who focused more on childhood experiences, and started doing some of that work. And within 4 months, my back was better. And that was, 16 years ago or so. I've never had surgery. My back is perfectly fine. I do everything. I play sports. I golf, I play basketball, no problems. And not only that, but
you don't torque your back. You torque your back and hit that ball?
I can do anything.
Wow.
There's not one thing I can't do with my back. And
So happy to hear.
And my torn rotator cuff went away. My migraine headaches went away. I had acid reflux so bad that I had it since I was a kid. I had it operated on. So they like poked holes and wrapped my esophagus real tight so I can't throw up now. But I had that surgery and I was still getting acid reflux and still taking medicine. That went away. I'm not on those pills anymore. I used to be lactose intolerant. I don't have any problems with dairy. I eat cheese, ice cream, milk, whatever now. I mean, the list goes on and on. There were a whole series of things that I just always had. Oh, arthritic knee. I had really bad arthritis, even though I was a pretty young man. That hurt. They said I, probably just need a knee replacement. My knees are fine. I don't have any problems. So that's how I got into this. Now, but that wasn't my field. I was in a different field of education. I studied college student retention and how to supervise counselors. So I've been doing that most of my life. And I had taken an administrative role at my college, and it was something I really hated. I know my back started to hurt again. This was years after it hadn't caused me any problems. And I was talking to my wife, and she says, it's probably that you don't like this job. You've been miserable. You don't like it. And I said, yeah. So I was trying to quit, and my boss just really was not someone you could quit on. And finally, I'd had enough. I couldn't get out of bed one day. The back was so bad. And so I told her, I said, we have to find someone else to do this. It's making me unhappy, and physically I'm not doing well. And she said something really amazing. She said, okay, you can quit if you want. But if you don't want to do this, what do you want to do? And I said, well, what I really want to do is help people who have back problems like me, because I know this is what's causing this again. And she said, well, there's this thing called a bridging fellowship at our institution, where if you can find someone over at our medical center who studies what you want to study, you can apply for a grant to basically get a paid leave for a semester and go study mind-body medicine. Oh, and so that's how I ended up meeting Bill Watson, who's going to be one of your guests. Yes. He became my first mentor in this. Bill sees people with seizures. And we have a regional seizure unit. It's a state-of-the-art facility where they hook people up to electrodes and wait for them to have an event. And when they have an event, they can tell if it's epilepsy or not. And if it's epilepsy, they say, good news, we figured out what it is. We give you anticonvulsant medicine and you're okay. And if it's not, they say, good news, you don't have epilepsy. And the people go, what are you talking about? I have epileptic seizures. And they say, that's not what they are. They're actually somatic seizures. And Bill does ISTDP therapy or recommends them to others who do it. And so I got a chance to learn from him. I took some classes with him. I shadowed him. Bill connected me with Howard Schubner, who was one of your guests. I got to go study Howard for a few days. He wonderful, let me sit right in his office while he saw patients, and I got to watch him do his magic, which was just amazing, jaw-dropping, watching people right in front of me get better, who had these incredible illnesses. I did some workshops with Howard. I did some workshops with Ellen Abbas. I went to the conference Rose that you mentioned. And then I got connected with a guy named Marvin Scorman, who is someone hopefully you'll have on. Marvin is a ISTDP master, studied back in the early days with Davenlou in the 60s, 70s, I guess, and lives in my town. And I didn't know it, but I got connected to him through Bill. And so I got a chance to be in a core therapy group with him. Johannes was one of your guests, is in that group with me. And Marvin's just been a master at just, teaching me some of the intricacies of this work. So I got to start a private practice, do some research in this area that's ongoing for the last 5 years. Looking at this chat, I got distracted. Someone saying we have to quit our jobs. No, I didn't.
So funny. No, Kevin, no. But it's a good point. Let's find out when the pain started. Right, Rose?
Yeah. Well, you usually can link it to an event, can't you, Doug? Yeah.
Well,
there's always an event, whatever.
That I ask people. It's not when your pain had started. It's what was going on in your life when your pain started. And often it's not that obvious. Sometimes it's simple. Like when I already knew what I was looking for, I could say, well, I started this job that I hate. And, that was the key. That's when it started. But the first time I did this work, it was much more complicated than that. I mean, Sarno used to say something like 80% of the people could get better from just reading the book. I was not one of them. I knew it was me, but I needed real help for someone who could cut through all the defenses and all the bullshit I had going on in my head. And I couldn't do it alone. So it was more complicated for me.
Yeah. Well, 80% of the people it goes away for, but it often comes back because they haven't gone back to the core problem. And it's sort of like, having a symptom. So you clean up the symptom, but the infection is sort of still there. And it arises next time. Just think about cold sores, for example. We'll say, your resistance is lowered. But no one says to anyone, why is your resistance lowered? And that's where we work in that area of the why rather than the symptom. So to bring it back to your life and to the fact that anxiety or something was always playing in the background, wasn't it? It was sort of like a tune in the back of your head that's always sort of sitting there, and to get away from the anxiety, you could have reflux.
Yeah, and I wasn't consciously anxious. If you would have talked to me, I was the coolest, easygoing, the type of guy always smiling, nothing bothered me. And I really believed that.
That was a problem.
But it wasn't true. Yeah, it was a problem. Exactly.
Yeah.
Living life more authentically is not easy. It was easier. And I have patients tell me this all the time. They get better, but then all of a sudden they're flooded with all these emotions. They say, it was easier being sick. This is really tough work. Being alive, being present, being, conscious of my emotions, sensing interpersonal difficulties and having to deal with them. It's tough.
Yeah. Well, often with patients, you'll ask them about their, how do they judge being angry, for example, and they'll make it a negative emotion, or sadness is a negative emotion. So they actually start off on a basis that they've got positive and negative emotions rather than emotions. So that sort of judge in their heads is sort of setting up the framework for rejection of their own feelings, which is quite sad, really, isn't it?
Right.
Yeah, and sometimes they develop these ideas before they can even talk, based on relationships with caregivers, right? They figure out very early what kinds of emotions their caregivers can accept and are okay, and which ones they can't, which ones are even dangerous. And so it becomes this process of, through childhood, just learning to disconnect and push back things that are perceived to be dangerous.
Yeah. Well, we often put up Tronic's still face experiment on our website for people to realize how insidious it can be, that, like it's microseconds of disconnect that haven't been reconnected. Start this up. It's, a mother's illness, a child's illness, probably even being in an insult cot for I've lost my train of thought. For early delivery. Premature.
Yeah. You never
Yeah.
think that's a problem for the child or the mother or the household.
That's right. And see, nowadays, the mother or the father or someone is allowed to actually hold the child's hand, although they might be in the insult cot. Whereas when we become adults, we don't even think about that sort of stuff because it's beyond our memory. But our internal memory is still there. And actually, Doug, do you talk about with your students about the fact that the right hemisphere isn't mature enough to actually express those feelings? Can you sort of go down that road a little bit?
I'm not as skilled in a lot of the brain-based stuff. I mean, I've read some of the things about reptilian brain and different hemispheres, but my expertise isn't in exactly the different portions of the brain, but I can talk about different parts of personality more metaphorically is usually the way we talk about it.
Well, that would be lovely because we don't have a voice until we're about 2, or an ability to express what's going on for us, except we do it through actions like throwing ourselves on the floor crying or screaming. And then after about 2, we can actually speak about it, but we've already learnt the pattern to keep quiet. That was
Yeah. So I find that with a lot of folks, they'll go through. I don't necessarily have to go backwards. Like with a lot of ASTDP, we deal with the present situations, and then the past just seems to come out of nowhere, right?
It does.
They'll be dealing something with. They're upset with me or a coworker or something, and we, foster those emotions, allow space, normalize them. And next thing you know, they go, oh my God, I just had this memory of, when I was a kid, and then we're off and running. I tend not to. It's one of the beautiful things about this approach is I don't ever go back to childhood. They do it. They pop in there. And then once they do, it's much easier to just kind of remind them, well, do you remember what we were talking about before? And then they go, yes, this probably goes way back.
What's so beautiful is that what Rose has taught me and what I've been learning a lot is that, we really do have patterns of behavior. So if we see something in the present, it's not surprising that there's a similar pattern, So, when you were talking about your how old were you when you had your acid reflux and you had surgery?
Oh, I was probably 8 or so when it started. I had surgery by the time I was in my young 20s when I had it, probably 23 maybe when I had the surgery.
Did anyone talk about anything related to stress?
No, nobody was mentioning that. It was, a structural problem, and, they just, needed to fix that valve is all that ever got mentioned. And there was some amazing medicines that came around at that point too, proton pump inhibitors that would greatly, just sort of reduce the amount of acid. So, you didn't have to really do any emotional work. You could just take a pill in that acid. But of course, as Sarno said, the symptom imperative, you fix one thing and if it's truly TMS, it's going to pop up somewhere else.
And what a lot of people probably would say, I mean, I learned this just being a sensitive person, that when you're more sensitive and you're emoting more, or you have more of a yin personality, or whatever we want to call it, right brain, left brain, but that I have a more acidic nature. If I'm more sensitive, it's like maybe that more alkaline, more acidic. So that could be, if we were to study, it's not important, if we were to study people that I don't even want to go there, because people say, oh, I'm sensitive, it must mean I'll get cancer. I mean, what I'm saying is that, is it true that more sensitive people are more acidic? I've seen that, but I'm not sure that's a field of study I really care about. But
I know people with TMS definitely have a lot of stomach problems, whether it's acid or irritable bowel or colitis or all these different things. I get tons of people who come in with those kinds of things, and they often.
Well, if you frame it as smooth muscle anxiety, you can take it all the way down to the kidneys, to the bladder, to the uterus. All the way through.
Yeah, and you were talking about, the defenses and things. You can see one of the fun things and special things about ISTDP is you can watch these things in real time. So as the therapist poking on different emotions that someone has and asking them to focus on their body, they'll say, oh, my stomach, or you'll even hear, grumbling and noises, or they have to get up and go to the bathroom. And, then we can process together. Did you notice that when you started to feel something there about whatever we were talking about, this problem with your stomach activated? We just do it over and over and over with them, because it takes different forms. It's often for TMS people physical, but not always, right? They can, have cognitive disruption where they kind of go blank and go, wait, what were we talking about? And those kinds of things that, Davin would talk about. Shots. A lot of people get nerve pain. They'll feel, like they get a nerve shot, or a backle. That's what used to happen, Rose. We were talking in the beginning about groups. And one of the problems, because I've run some groups doing this, one of the problems with groups is that people get activated in the group from other people. So if someone's expressing strong emotion, other people in the group would be, oh my God, my back is killing me. I gotta get up. It must be this chair, but it's from an ISTDP or TMS perspective, it's really just uncomfortable emotions getting stirred up, defenses getting stirred up, and physical pain being a way to deal with it.
Yeah, it's sort of like the mirror neurons sort of happening in the other participants, isn't it? Yeah.
Oh, it used to happen all the time. It made doing this in a group very complicated. Made it good too. It was ripe for interactions and projections and things, but yeah, it was a lot of work.
Right.
Yes. Yeah.
Right.
Well, there are a couple of groups going. I think there's one in California at the moment, an ICDP group for addiction with John Fredrickson. I think there's probably another one going on in Holland still, I think. So there are a few around.
On that note, I would say that, Gabor Matai talks a lot about addictions and childhood traumas and why the Alcohol Anonymous group they made Gamblers Anonymous and, other kinds of anonymous groups. They have Emotional Anonymous. And I happen to believe that TMS is like an addiction to pain, or addiction to hating yourself, or an addiction to judging yourself, or an addiction to not being able to recognize your feelings. Or I don't know if I'd call it an addiction. Would you, Rose?
Well, it's a common word that people know about. But, earlier on when we were talking to Doug before, we were talking about the fact that as in childhood, places like the nurse's room clinic in the school was a safe place. Would you elaborate on that, Doug? Because it was really so appropriate, and especially when with what Tova's just said about, she's used the word addiction, but it's not really the word we use with chronic pain. But it is that, if I can keep going to the nurse's station or whatever it's called, you can actually have a peaceful place and someone's really going to be listening to you intently. Can you sort of elaborate on that? Because it was such a beautiful way you said it.
Yeah, I've had a number of folks, clients, come to those understandings on their own, really, through the work. But and usually in hindsight, like when we'll go through a lot of the ISTDB process, and then they start looking back and they go, having thought about it, I guess I've had a lot more medical problems than I realized. Like as a kid, I used to have stomach problems nobody could diagnose, or I used to get headaches, or, those kinds of things. And then they'll say things like, I think that was wrapped up in this. Nobody ever knew this back then. And, maybe there was something comforting about, being cared for because my home life was so chaotic or whatever. And that they realize, they make the connections later, that there's a way to be cared for through your illness that is comforting, that provides love, safety, security, that maybe wasn't available to them in other forms, or even the parents that were struggling and, had their own issues and weren't always attentive, but the kid got sick and then everyone had to drop what they were doing and be attentive. It's not to say kids fake it. It's not to say kids make themselves sick on purpose. That's not what this is, right? It's a very deep subconscious process to have needs met. And it's not everybody, but there are some of my folks enough that I've noticed that is a pretty big pattern that realize this on their own through the work.
Well, what struck me was that peace and harmony when you go into a doctor's office or a nurse's office. You're there, you're being completely focused on in that 15 minutes or whatever. The focus is on you. And when you go home, you could have multiple siblings or parental illness or whatever. And you often have chores to do rather than just be you, just be or care for siblings, often we find. And and there, when we go to school, we've actually got a space to be heard. So that's what I thought was so beautiful, that, you can think.
Go ahead.
Sorry?
I was going to say, I even had a client who talked about he was an orphan as a kid in an orphanage in a different country. And he said, I have a feeling that's probably the only way. I knew I was a sick baby when I got adopted. And he said, I have a feeling this is probably something I learned before I could even talk. That, when I was sick, that was there were hundreds of babies in this orphanage with only a few people to take care of them. And he said, I probably got attended to by being sick. This was something he surmised on his own after doing this work, but it seemed real powerful to him to have that understanding.
Yeah.
Wow. I'm not sure if it just made me think about when I was younger, I always wanted to be at my neighbor's because they had a Christmas tree and all sorts of amazing things happening there, and 5 kids, and I don't know where my parents were, but they used to have an Easter basket for me and something under the Christmas tree. And I was so jealous. Forget that I wanted to be Christian, but, because, Hanukkah was nothing compared to Christmas. But the point was, I wanted to be in their family. And I think that could have been a subtle trauma of like rejecting my family or whatever my little mind was perceiving. I mean, and they were giving me all this attention. And so it's kind of interesting about subtle. Subtleties.
Yeah, it's subtle. Yeah, you don't even know about it. Yeah. Have we got a lot of questions out here on the right?
Paula has been asking some interesting questions. She's right with you, Doug, all the way. First of all, she mentioned the surgery. Did you have the surgery called LES surgery?
I think that's what it's called. Yeah, it was years ago, but it's a wrap. They wrap around your esophagus, tighten it up, and so now nothing can come up.
Yeah, and she wanted to know, did you know, you didn't think the acid reflux was from stress back then? You just assumed it was just your body was creating more acid.
I was told it was a structural problem, that the valve here was not working correctly. And
you have no problem.
And then they could be really frightening. Like there's this thing called Barrett's esophagus that if stuff comes up, you might not even feel it, but you can get cancer in your esophagus because the acid keeps coming up. And so it became this really frightening thing that I had to have this surgery or else I was going to get cancer. And then the reality is, looking back, I never needed that surgery. It was
right.
The form of TMS and stress causing it.
And then Paula wanted to know, this is interesting, Rose, for you too, and maybe you as a nurse and your experiences. Do you see a lot of clients that were actually adopted? Is that a common theme? It's an interesting question.
I've had a handful. A common theme is chaotic childhoods, for sure. But even that, people sometimes come in and say, my childhood was perfect, so I'm not sure how this fits for me. But then, we often do some work and figure out there were complicated things back then that they just weren't in a good position to sort of process. But there's always, there was a big study you're probably familiar with. Maybe you're not because it was a U.S. study, but the Adverse Childhood Events Study.
We know about it. Yeah.
Basically shows that, the more problems you had in your life as a kid, the more likely you are to have health problems, to die earlier. It's astounding the correlations.
Can you explain that to our listeners? It was called ACEs, Adverse Childhood.
Adverse Childhood Events Study. It was done by a major health insurance carrier, Kaiser Permanente. They went and basically, I think there were thousands, something like 20,000 people or more, who filled out this Adverse Childhood Events survey, which basically assesses anything that was problematic in childhood. My parents were an alcoholic. My parents got divorced, or someone had mental illness, or I was abused in some way, physical, mental. From really severe things to just things that are pretty troubling to kids. And they found a few things that were astounding. One was just how common adverse childhood events were. Something like, I don't know, half or something had at least one, and the numbers of people who had multiple ones were incredibly high. Wow. But the thing from a TMS and health perspective that they found, which was just incredible, which was that the more ACE events you had, the more likely you are to be sick, and not just mental health. Mental health certainly factored into it, from mental illness, alcohol and substance abuse, but physical illness too. Heart disease, diabetes, cancer, chronic pain. And it was, they labeled it a dose response effect, which means that the more ACEs you had in childhood, the more likely you are to be sicker and die earlier as an adult.
Wow.
And medicine still hasn't exactly figured out what to do with that. It's been around quite a few years now.
It has.
But the correlations were astounding and not something anyone can ignore.
Well, I'm really happy that an insurance company, a health insurance company did that. That makes me really happy. I'm interested to shift a bit and just ask you, so you're, a TMS patient, you really have been through it. You have, seen your life pretty steady, get better and better, and you rearranged your life and redirected your career to become a professor and now a therapist, and you just seem like really happy as a bumblebee. Now, let's just say...
Not necessarily. I got issues. Trust me. I still got issues.
Well, of course. That's what makes you such a good doctor and a good teacher.
Yeah, and I'm still in therapy myself. Right.
That's what I wanted to ask you.
Yeah. Oh, yeah. I just talked to her on Saturday.
Ask you something personal. And Rose always says, Tova, no, don't do that. And I'm like, no, I'm not. I have to ask them if they're in therapy. No.
Yeah. Oh, yeah. No, I've been in therapy off and on for 20 years, but I've been in it again. I found a wonderful person. Like I said, there was this ISTDP community here in Rochester, and I was able to connect with someone who studied with Davin Liu, and she's phenomenal, and keeps me grounded.
Great.
And I only see her every 2 weeks, but by the time I get to see her, I know I need it.
After this show, you might need her every day. But anyway, I'm really happy that you shared. And you know what?
Her name's Deb LeBeau. I'll give you her name. She's retired and not taking anybody else, but
I tell people that no one is immune. No one is immune. That was kind of like when you were coming on the show, like no one is immune. We're all going through this, but what Rose tells me is that like I get TMS, but maybe I'm more resilient at times.
Oh, we get it, and I still get it, and I tell all my patients that too. I liken it to a check engine light on your car, right?
Exactly.
When the light comes on, you're always going to need a checkup, right? When the light comes on, you don't disconnect the wires or cover them up with tape. That's not how you treat that, right? It means bring it to a mechanic, get under the hood, do a full diagnostic, and that happens to TMS patients their whole life. My shoulder's been killing me for about 2 weeks. If I didn't know better, I'd swore I tore my rotator cuff again, something's going on with it. I got, stress at work and things going on, and I know exactly what it is, right? It's TMS for sure. But having this awareness, it doesn't mean I'm not going to get stuff. Right. It just means that I know now not to run to the doctor right away, to just go within, take it to my therapist.
Respond, not react.
Yeah. Can you comment on what Susie just said about ISTDP? You don't need a long-term therapy. I think what Doug is saying is that he recognizes that he's got an internal problem, but he isn't activated about it in the same way. But because he has got a long-term therapist, he can go and chat to her about what's going on. Would that be right? So
and in fact, most of my folks, I tell them, you're going to be done in the shortest amount of time possible and not one day more with me. And so I don't intend to see them beyond when they get better. And when they get better, it's funny because that's originally I had a few people very sick get better pretty quickly. And I said, okay, we're done. It's time for you to go and I can see more people. And one of them said, great. And the other one went, are you crazy? You can't get rid of me now. We've been through all this together and I'm not ready to, I'm just opening up to all these things. And so now I don't say that anymore. What I say is, I'm here as long as you need me. And even if your physical symptoms are better, I'm still here to meet with you as long as you need me to. And so I leave it up to them. I'm not in a hurry. I've realized it was the wrong thing to do. It was a mistake to rush them out.
Look, there's a preconceived negative thing that you're weak when you go to therapy. I tell everyone you are strong to look inside and say, I need some assistance. That is a strength.
Mm-hmm. Yeah. And then together, our job is to get you in a place where you're able to handle these things on your own without needing me. And you will get there at some point.
The doctor within, the nurse within, the therapist within to really self-heal.
Yep.
So I wanted to address Kevin's question. It's a long one. Listen up. Kevin is actually a songwriter. So he's a sensitive boy. I had the symptom imperative from pain to anxiety. Is the idea that the pain was to anchor the anxiety and therefore when the anxiety surfaced, we are then stuck with it?
Yeah, that usually happens to my folks, is that meaning that the anxiety is all about the physical pain. Right? They have a lot of anxiety, but it's usually around their symptoms. They're on the internet looking up stuff. They're chasing doctor to doctor, test to test, medicine to medicine. Everything gets projected into that illness. And when we do the work and the illness goes away, they often have a lot of emotional issues that's when the real therapy can really begin, as we dive into the severe anxiety, feelings of sadness, grief, loss, depression. Stuff just comes up that they haven't experienced ever. And that's, I usually see people every 2 weeks for about an hour and a half. And then when they physically are getting better and emotionally become less regulated, more vulnerable, we start seeing them every week, usually. Not in all cases, depends on the person. And that's when people will say, it was easier being sick sometimes. And they say, no, I don't want to go back there, but this is really hard living this way.
It is hard.
Being more authentic is unsettling and scary. And, I'm uncomfortable and my relationships are starting to change. And, it's funny. I was looking through my list the other day because I was giving a talk and I wanted to figure out how many people, like what percentage I'd helped and what I hadn't and who was there. And I was going back through the list and some of them I couldn't even remember what they came in for. Because the work had shifted so much to their emotional issues, childhood issues, psychodynamic type issues that I was like, I'd have to go back and look at my notes. I know they were really sick when they came in, but I have no idea what the presenting issue was because the work had shifted so much to some of the kind of emotional, intrapsychic things that became such a focus. I could tell you all about their issues, but I had forgotten why they were sick in the first place.
I think this topic is coming up, and I think it's something we should address as three, therapists and people that have had TMS, that have had issues. But this woman, Susie, is asking a very important question. She says, I agree, it's good to have therapy, but she repeats, it's expensive. Now, I'm going to answer that, but I'd like you and Rose to sort of see what you think about that and how it falls into place as therapists.
Do you want to go first, Rose?
Go ahead. You want to comment on it, Rose?
Most of the people that do this type of work have already got a PhD. They've spent up to maybe 30 odd years to their 30th year doing their study. And then for ISTDP, it's a 3-year core training program. And then after that, you have advanced training, which helps us notice microseconds in a patient. So most ISTDP therapists are actually the specialists in this area. So when you go to see the orthopedic surgeon, you're going to be paying $400 or whatever. But when you go to see the GP, you'll only pay maybe $100. I don't know, wherever you're living in the world, what the price range is, but the specialist is going to cost you more. And really, that's what it's about, isn't it? It's about we being specialists in that area, but we give a different space to patients' problems. So unfortunately, I believe that the insurance companies don't do a very good job with providing care. And I know in Australia, patients get funding for, I think, 6 weeks, and that's it. And then they've got to wait another year for another 6 weeks program. But most patients probably need a year of spending time with their therapist. Just to, you break the ice in about 8 weeks so that people can see what's going on. But then, as Doug says, you also need to actually explore and release or undo the idea that, being angry, you don't have to express your anger as an outburst. Anger is a sort of a defensive mechanism when you're hurt. And you utilize it to speak up for yourself, not to hurt anyone else. And if you're sad, it's not a bad thing to be sad. It's a human condition that allows you to have empathy for yourself, to have grief for how you've struggled, and to have all that sort of measured is repressive in a patient. So when they come to therapy, they're the areas we look at once they've realised the connection between the chronic pain and their own, pain in their own heart. So unfortunately, it is expensive, and that Kaiser Permanente company to actually look into that. I presume they probably give more funding to that now, do they, or not? Do you know, Doug?
I'm not sure what the implications from an insurance perspective were. I don't think a lot. I mean, in the U.S., we tend not to reimburse for TMS type therapy for chronic pain. Most of my folks come in with anxiety and depression too, and they already have diagnoses for that, so they get funded for that. But I just wanted to jump on what you're saying, Rose, about cost, because I used to be real sensitive to that myself as when I first started doing my private practice. Like, I'm charging these people and I feel so bad. I need to fix them right away. And it was like a big thing for me personally. And then I realized something. A lot of my folks got better, and many of them had spent thousands and thousands of dollars on stuff that didn't work. I mean, they come in with stacks of tests,
right?
All stuff that was inconclusive, negative treatments, medicines. They, many of them would come in wanting me to look through the files and see all this. And, I'm never the first, always the last. And many of them get better. And so I don't worry about the cost anymore, because I realize if they do the work and it works the way I want, it's going to save them a lot of money. Now, having said that, I don't want them to spend a fortune with me. I don't want them to have to be in this forever. I recommend that they do lots of stuff on their own. That's why I meet every 2 weeks and not every week in the beginning, because they have homework in between. I recommend Howard Schubner's book. He's got a book called Unlearn Your Pain. Everybody that sees me, I have them get that book first. And if you're listening at home and you want to know more about this, get his book. They read the first 4 chapters. If it makes sense, they come see me. If they don't, they keep looking. And then we use it as a workbook in between. There's lots of journaling, meditation. I love the Curable app. And not everyone's into it who's not tech savvy, but if you're tech savvy and you like that kind of a thing, the Curable app, I forget, it's like $12 a month or something. I mean, that's not very expensive in the grand scheme of things. You pay more for Netflix than that, probably. So, the TMS, that app is based on TMS research. It's got meditations, exercises, things to read, the social support too. And this TMS roundtable is something I prescribe, these kinds of things. I like Eddie Lidenstein's Mind and Fitness podcast. The idea that you're listening and engaged with other people all the time helps reinforce the subconscious that's really what like Sarno said, you have to really truly accept the diagnosis to get healed. If you're skeptical, you can be half in. I tell people, you can be half in's fine, but you can't be really skeptical to have this work. That's why when other people's relatives or friends or parents or spouses call and say, will you see this person? I say, no, if they want to have them read the book, if they want to do it, I can have a conversation and see if it fits. But you can't force someone into this work. I used to try to do that all the time after I got healed. I wanted to go save everyone. And people were just like, what, are you crazy? I have a herniated disc. This is, I'm not going to talk to a therapist. And so I've learned to, present it more carefully.
I refer people to All the Rage because it's visual and it's in the first person. I love it.
Because I do too. I have everybody watch that. We watch it in I teach a class on chronic pain, and we watch All the Rage. It's one of the movies we watch. Like I said, Sarno saved my life, and I never met him. So when I watch that video, I feel, kind of choked up watching this guy and how he suffered, in the basement there at NYU, not getting a lot of accolades for the revolutionary work that people were not ready to.
Well, we're right here, right this minute, with his soul looking down, carrying on like the Elvis or like the John Lennon, may they rest in peace. Like, this is his work. It's being researched. There's scientific. There's just so many people carrying it on. He was truly a pioneer. And, and I want to make a quick comment about the financial thing, because I know for Susie, she's pretty pissed off. She's like, it just seems wrong. And she has a right to feel angry. And that's part of her pattern of like, it's not fair. She's being taken for granted. And I understand that. But as a patient, as a therapist, as a doctor, had working with insurance companies between my chiropractic years and when I was in America, and trying to be involved in the care system in Israel, I like the theory about balance. I know, and I say to people, if I gave this for free, this therapy for you for free, you wouldn't get better, because there is some psychological thing about it being accountable and paying for what. Now, that's one part of it. Another part of it is if my patients ask me, I'm having some difficulty. We just went through Corona. I'm working part-time, and I'll say, okay, you can pay me X amount over 20 weeks, not 8 weeks, because I trust you that you're invested into this process. So I think, and I say to people sometimes, like a year later, why didn't you do therapy with me? Well, I didn't have the money, so why didn't you ask me? This was part of the therapy. Why didn't you ask me to work out something, to financially figure something out? Like, I think it's all about the therapy, how you deal with money.
Yeah, it's interesting you said that, because I've come to that realization too. So when I first started and I had more availability, I did take some people on for free, and they tended not to be as dedicated to the work. In fact, the groups I ran one completely free, nobody had to pay, and I ran another one where I charged, and I charged a bit. It was relatively expensive, and the people who were paying were more committed to the work. And sometimes when they didn't want to come, they'd say, "Well, I'm paying all this money, I figured I should just come," and they did the work. So I can't take anybody now, but I had taken people on a sliding. I decided not free, but because I wasn't seeing the kind of commitment from them, they'd cancel a lot. And now I do a sliding scale. And so it was, something that was not intended to break anyone by any means, but enough that it would create enough motivation that they could be committed to the work. And so I've had a few folks have financial hardships while we were in the middle of therapy, and I'm not going to drop them. So, we just found a way was able to slide the scale to something they could afford and they could continue with me. So those are some of the ways I've approached it.
Right.
And it's the inability to speak up.
Right.
And it's their interactional pattern. And it's often why they've got their pain, because of their interactional pattern, that they wouldn't speak up. But Tova, I just want to know, if you gave it all for free, how are you going to pay your rent? How are you going to eat?
Well, that's just it. It became my issue, and I needed therapy. So that's what I learned over the years. When I first became a chiropractor, I was just a young puppy, and I remember going to therapy and learning how to say, like, how do I say to a patient, I don't know how to help you, because that to me was devastating. And I think what we're talking about is that as therapists, we're people too, and we have to learn to ask. Like, it's a whole issue for us. What you said, Doug, is we had to learn to value ourselves. So I know when patients feel like they're getting a value and they feel better, this money's going to be invaluable, which takes me to one last thing I want to say is this is tools for life. The insights and methods that Rose and I have learned from ICDP and TMS and Michael Galinsky to Alan Abbas to David Schechter. I mean, these insights are for life. They're life skills. I'm not just teaching you how to deal with feelings and know yourself. There's nothing after this. I honestly feel like after this chapter, you're coasting. You're dealing with your feelings. You're accepting yourself. You're observing. You're being mindful. It's like, I think this work is the honest truth. What all the gurus are saying, what Jesus said, what Moses said, what Allah said. I think this is just the truth. Love yourself like you love others. Be good to yourself. Take care of yourself. Honor yourself. What do you think of that, Rose and Doug? I just felt a release.
Well, that was a great sermon. That was a fantastic sermon. Now give us the key. We should do this. We should do that. We should do the other.
Well, I think this is amazing work. Pressure. I just think these are tools that we give, which is nothing new under the sun. We're all talking about how to live with yourself, how to love yourself, how to accept yourself, how to accept your pain, how to not be a victim. I think this works in every relationship with yourself, with your parents, with your children, with your doctor, with your therapist, with your rabbi, with your priest. This is a relationship. And they say we're relationship beings. And like Rose says, we're made for love. And this is what we're teaching you. So
yeah, I haven't had anyone who's been through the process with me ever come back and say, boy, that was too much money. Not even close. I mean, most people, what they say is, I wished I would have found this earlier. They owe it. That's the biggest thing I hear is, why didn't I get this earlier? Do you realize the amount of money and pain I could have saved in my life? And they come in angry that nobody told them this. And, my response is always the same. You find this work when you're ready for it. When the conditions are right in your life, this collection of things, the book doesn't just drop in your lap by accident. There's a time and a place for you to go through this process. And when it's there and the right resources are there, it's time. Maybe the other conditions in your life weren't right. Now remember, these are strategies that people developed to get through. They were adaptive at one point. They were helpful. All these defenses we're talking about were helpful to the child and to the young adult or whatever during a certain part of their life. And so they couldn't have lived without them. Right? Had they lived more authentic at that point, their families couldn't handle it. Their life situation couldn't have accommodated it. Right? People come for therapy because the way of handling their problems no longer fits with their current life situation. Right? And instead of trying to do something different, they're trying to do more of what didn't work. And so that's what I tell people is, you came because the conditions were right and it worked because the time was right for a change. It probably wouldn't have been as helpful to you earlier because you weren't in the right situation to experience this in the way you needed to. And I can't explain it either. Believe me, I don't understand why this is the way it is. I just know that it happens.
Yeah. Well, isn't that how it is? That what's that saying? The teacher arrives when the student's ready.
When the student's ready, the teacher will come.
Yeah. Yeah.
And then the student becomes the teacher.
Yeah. Well, that's what we see. Look at us.
You don't need the teacher anymore when you become the teacher. That's what our job is. I say, who's the doctor here? Rose and I are just messengers. We're just bringing the message. You guys are the doctors.
Yeah.
Yeah, the job is to work yourself out of a job as a therapist.
Exactly. And that's the beauty, really Yeah. Like I actually do the opposite. I like patients to come weekly at first to reinforce what's going on. And then once they've become aware of their own internal conflict, I push them out to twice every 2 weeks. And then further on, I push them out to 3 weeks because they don't need to be with me, because the ICDP work always happens when you leave the room, not in the room. Yeah.
Mm-hmm. Yeah, so, I got probably about maybe a third of my caseload I see once a month or once every 3 weeks, because they're better and they just start checking in, and eventually the relationship will end when they're ready to. But I'll encourage them to stretch it out in ways that push them a little bit to do more on their own too.
Yeah, and also one of the lovely things about ICDP is that we even have a way of actually separating ourselves out from the need to be with the therapist, so that the person becomes independent and fully able to cope with their own feelings without needing to be with someone. Mm-hmm. So I think that's the lovely thing. And actually, Patricia Coughlin, in her book, she sort of checks in on patients every 5 years to see the growth that they've had. Yeah.
Excellent.
And
I see a question. I have a hard time talking while I'm watching questions, but one struck me that I wanted to talk about. Kevin said, you have to make major life changes in order to stop it. It feels like my mind is operating and stuff. So this idea of making changes, one of the things I always caution my folks when they start is that there's nothing to do yet except be in this process with me and with yourself. There's nothing to do out there, out of the office just yet, because we don't even understand what's going on. Because a lot of people come in like, what do I do? What do I do? What do I do? I got to go do something. And I'm usually pulling the reins back saying, no, we don't even know yet what's going on for you. There's nobody to yell at or divorce or break away from until we understand it. Because what they come in with is usually ends up evolving into something much different later when they look through it with fresher eyes, without this baggage and defenses. And so even when they have major breakthroughs in therapy, like, unlockings and things, and they'll say, okay, now I got to go do something. No, not yet. Yeah. Just be with this right now. Be with yourself. Now, because a change in the person changes their system. I've seen that a million different times, right? Just changing who you are, how you relate to people in subtle but important ways internally will change your system, because people will say, well, how's anything going to get better? Everybody else in my life is crazy and out of control, and if I can change, but it's still not going to change my terrible life circumstance. And I say, well, let's just see, what happens inside. And a funny thing happens with most people is that sometimes people drop out, right? That meaning that people in their life who can't handle the changes they make may drift away. But other times people step up. Right. And it comes in subtle ways where the person will just notice themselves being more assertive in a way that they hadn't before. For TMS people, subtle assertiveness seems terrifying to them. It's like they're out of control with rage, even though they might just being, like Tova was being a little bit assertive about, paying for things and, having a right to have a life. I mean, which is a perfectly appropriate, normal, healthy thing for a TMS person that is like incredibly self-centered. They have these super developed super egos that are always yelling at them that they need to be better and perfect and all these things. And once we relax that voice and they can get more grounded and just being present with people and honest, this natural assertiveness sometimes comes up that people who really care about them will gravitate towards people that see that as a problem and can't handle it often, sometimes need to step away. Sometimes they step up. But to answer that's a long-winded answer to the question, but generally, I tell people no drastic changes are allowed in the beginning until we understand.
Definitely. Yeah. There's no need for them, really, is there? Because as you peel back that onion sort of thing, you need to stay sort of stable and just see how you're interacting. And that's the other thing about Michael Galinsky's movie about being how does he put it? You're the main actor, and all the others are bit players in the reality of it. And sometimes we allow others to become the main actor and we step aside to allow them to be the main actor. And I think if anyone hasn't watched All the Rage, it's probably a good thing to do, just to see the subtle difference that therapy and insight can make.
Here's a question from Mia. Here's a question from Mia on would you recommend journaling besides ISTDP therapy? And I just want to mention to everyone listening that, it's such a personal experience. And it's not black or white. And sometimes I think journaling is excellent and sometimes it may not be. I think it's something we have to, we have these basic insights that we see that help people, whether it's meditating or exercising or journaling. And I think at various times in our process, these things would work better or worse, but I don't think it's a black or white thing. What do you think of Doug and Rose about that?
I generally have everybody engage in journaling in some form, even if people aren't real big writers, just to jot down some terms and some feelings that come, some people's names with some feeling words. Other people who are more skilled at writing will come in with a lot of written work. And when they're doing that, whether on their own, if they're not in therapy, which, Sarno, Nicole Sachs, who does all the journaling things, I think would say was really helpful, or they're in therapy, when they do it outside and they come in with the journaling in hand, or at least in their mind, it drives our session. So instead of me having to do a lot of work poking around, they come in saying, okay, here's what I got to talk about. I started to write about this, a bunch of stuff came up, and now they're driving the session based on the work that they did. And that's often when our sessions can really go into high gear, because they're thinking about these issues all the time. It's a part of their life. It's part of their mental process going into it. And so we can really make the best use of our time.
Yeah. Well, I've often found that the journaling, unless it's focused in the right way about their feelings, not about what other people have done to them, it just creates more havoc for them. So until they actually realize it's not about what others have done, it's about what the reactions that they've got internally to that. So if people journal, I say well and good, but if you don't, that's okay too. But as Doug said, if you've got an internal problem, because that's the first question really in ISTDP, what's the problem you want us to help you with, or what do you want me to help you with? What's your internal problem? So if they can journal with an internal problem, it should accelerate the issue. But when they journal about what people have done to them, it seems to increase their suffering. That's my
Yeah, and then you can do the basic. I mean, look, and then the basic journaling, expressive writing was researched, and Dr. David Hanscom spoke a lot about this. That their research was when we took the thoughts from here to the paper, there's some like the brain just calms down, and so for that part of the process, it could be very helpful. You know, and then it can be used. The words can be used to hurt you or help you. So, I think it all has a place.
Yeah. Well, apparently we've got more receptors in the brain for our fingers than any other
Wow.
part of our bodies.
Wow.
Yeah.
Wow.
So
Rose,
when
I
you're
think
holding the pen, sorry?
Go ahead. Finish your. I didn't mean to interrupt.
No. So when you're holding the pen, those receptors in the brain are connecting to what you're writing, I gather. I learned that through Montessori, having kids in Montessori schools. I learned that.
Yeah, they said that. They said you can't type it; you have to actually write it. So
it's better.
Write it.
Yeah. Well, I find, but maybe because I'm an old learner, that if I write something, it stays in my brain. Whereas if I type it, it doesn't have the same effect. But I presume that's to do with age. So.
No, I think that we're going to see a change in our lives over the next 20, 30, 40 years because we're not writing as much and we're typing. So you're going to follow up on that, Doug?
I just wanted, Rose made a good point about the type of journaling you do. And that's really important, right? Because you can really spiral and loop with this, turning it in against yourself or just.
Yeah, well, that's what I found. That's why.
Where one of the questions I ask TDP always ask people to consider is, how did you feel towards the other person, right? So instead of taking it all in, it's coming out. And that's one of the questions we ask a lot. Well, they hurt my feelings. Okay, but how did you feel towards them for doing that to you? I felt sad. Okay, but how did you feel towards them for making you sad, right? It's like sometimes there's an inability to do anything but turn it all inward. And one of the things we try to do is get people to allow that energy to come up and out. And so journaling, there's some good, I mean, Schubner's got some great ISTDP-based journals. Nicole Sachs has some great journal structural journaling activities. The app, and now I'm drawing a blank on it. What was the app I mentioned earlier? Curable has some good exercises that help people turn it out instead of internalizing.
David Chapter has a 30-day book. You can buy it for $30 on Amazon. It's a 30-day. Every day there's questions. I mean, if we want to be fed the questions, and they're very, very profound, and they, and I always say to my patients, if you don't want to write something, just say I don't want to write anything today. Just show up and move. Just show up. What do they say? It's so it's such an art. It's such an art. And Cheryl wants to comment and say that Rose, that she found journaling made. I found journaling. This is from Cheryl. She found journaling made her blame stuff and made her feel worse, where meditation is more mindful and responsive and worked way better as an alternative. Because meditating is journaling in your mind, journaling is writing, and so it's fascinating the different things that work for different people.
Exactly. Yeah.
I really like mindfulness meditation. So I don't believe meditation that just designed to escape emotions is helpful to the process. Mindfulness allows people to dive deeper into the emotional experience. So I do a lot of that with people. Mindfulness essentially is teaching people to be comfortable with the uncomfortable, right? Being very present in all experiences, even those that are really unsettling, terrifying, rage, extreme fear. And so mindfulness is something I try to teach all my folks to do, even if it's just as a matter of prep work to be able to do the emotion-focused work, because it teaches people to allow these things instead of be afraid of them. Other kinds of meditation can push things down. They're designed as escape, not and that can be counter to the process, I think.
Yeah. Also breathing with the being aware of the breath is very important in this therapy, in this area. Would you, Doug, tell the audience about your program? Is it 13 hours. How many hours is it that you've got at
we started
University at Rochester? It sounds amazing.
Yeah, we started an advanced certificate program to teach some folks how to do this. So an advanced certificate program is a smaller collection of courses. It's not a master's or a doctoral degree, and it doesn't provide a license or a certification. It just is a collection of things we put together to teach people who are already licensed or certified in a healthcare profession how to integrate emotion-focused and behavioral type work like TMS therapy into their jobs. So we've got nurses. I've actually got some people in our music school. Musicians have a terrible time with TMS type stuff. We have one of the top music schools in the world at Rochester, and so many of those folks are TMS people. So we've actually had some musicians
why do you
do
think
it.
that? Can you just comment for a minute why you think that?
Oh, personality-wise, the TMS type T personalities. Yeah. Many of them have this perfectionist.
So creative, so creative. I always say you're the smartest people. You're smart and sensitive. That's what we say to them.
I had this woman. Just a quick story.
Oh, we like this. We like stories.
Major musician. Her name is So Yoon Kim, and I can use it publicly because she wasn't a patient. She was someone who contacted me because she had heard I was doing Sarno, and she said, "I got to tell you this great story." And I said, "Great, come on over." She wanted to come meet with me, and she's a very renowned violinist. Played, headlined at Carnegie Hall and done some amazing things. And she said, "I got diagnosed with a ganglion cyst years ago, and it was taking over my wrist, and I was going to have to give up the violin." And she said, "I read Sarno's book and started doing some of the exercises, and the cyst went away. It disappeared."
I think I heard of this.
She said, I'm absolutely positive that that's what it was. And it was phenomenal. So she comes and talks to my class. I teach a class on, mind-body approaches to chronic pain. I've had her in every year. I actually introduced her to Howard Schubner, and she went and presented at one of his conferences because she happened to be attending, because she's trying to integrate this work into her music education, because she's found it such a profound problem with musicians who, they tend to focus a lot on technique, how you hold it, how you sit, what you do, but they're starting to realize there's a lot of emotion and TMS type stuff wrapped up in musicians' pain. And so anyway, back to the program is 13 credit hours, which means it's like 4 classes. We're moving it to fully online. I'm teaching a class in the spring that's going to be fully online, and we actually do give discounts to healthcare workers right now. We give 50% off for people who want to take the class and maybe get the certificate. And then I think we're approaching a point where we'll be able to offer it fully online. We've come a long way in that area since COVID, because many of us didn't want to do online. We're just like seeing people in person, but we had to, and it's working, and we're realizing we could do this really well. So I got a lot of people in our Bill Watson teaches in the program too. He's the guy you're going to have on in a few weeks who taught me this and who uses it with seizures. Are you? Okay. So Bill's a part of this. He taught me my first ISTEP class on emotion-focused therapy. I've got another guy in our program named Andre Marquis who studied with Davin Liu and a lot of other people, and he teaches one of the emotion-focused classes. So we've got a really nice, and we do it for non-therapists too. We have a track that's more therapy-focused, and then we have a track that's for doctors, nurses, other healthcare professionals who just want to integrate this into their work without being doing therapy.
Excellent. Well, I wish as a midwife that I'd had ISTDP training in my obstetric background, because just realizing that having a baby in your arms brings up so much anxiety that you can't let down, or in the delivery room when there's a change of shift, the patient stops her contractions, and no one looks at the idea. Well, they do now actually, and often in midwifery-led programs, the midwife stays with the patient, but I've seen the change of shift and labour just stop because of the anxiety.
Wow.
Or different people coming in and out, and even knocking on the door, and the patient becomes alert. And it's all about being at peace and being rested, and not having anxiety in all these medical conditions and or situations that, you know, I've worked in postnatal areas for mental health, and the patients just can't breastfeed because of their anxiety.
Yeah.
So
It's so hard.
it's such an important area, and to have other healthcare professionals be aware of it. And Alan Abbas, if there are healthcare professionals watching, Alan Abbas has got a on his website has got a thing about somaticization, and diagnosing it sooner, diagnosing MUS sooner. Yeah.
Mhm.
So anyone who's interested in the research, there's loads of it. Has Rochester got a whole lot of research on their website or anything for healthcare professionals to look at?
So I have some on my private practice website. I've put a bunch of links on there. I could share my syllabus for the course. I put tons of it in there in the class I teach.
Oh, that'd be
so I have
great.
a pretty good collection.
Yeah, that'd be great.
Yeah.
Before we get off track, and we might have to round up soon, but first of all, thank you for meeting us in the middle of your day. That's number one. You're in upstate New York. Two, you know, because we're a self-help program and we're like to really, you know, I tell people you can heal yourself. It's not like I'm being condescending, or, I mean, it's possible. And we're here to help you in any level. But, you know, so could you leave our listeners with maybe, you know, 3 of what you feel personally and professionally would really be, in general, what would help people the most? If they could go home today, and do something a little different, or what would you suggest?
Well, like I talked to somebody just yesterday who was very, very sick with something that he was told was incurable. And I knew for a fact that I'd worked with people who had gotten better for it. And the thing I told him, you can get better. I know that you can get better, and you can even do things on your own to get better. That most of these things, which make us feel helpless, and, you know, we get told by doctors that there's no cure. If it's TMS, you can get better, and you can do a lot of things on your own. And there's so many research. I mean, when I started doing this, there was nothing, right? There was nothing but Sarno's book. That's all I could ever find. You know, 20 years ago, there was nothing. And now there's just a million resources like what you folks are providing, and all the other podcasts and materials online and wikis. And, you know, so there is so much available to us now that, you know, so that one of the questions about therapy, do you need it? There are so many things you can do without a therapist right now that just weren't available.
Exactly.
Now, having said that, I personally believe for me, it was crucial that I went the extra mile and did the work with a therapist. I think I'd still be looping without that push and the challenge I got for that. But I think there's lots of people that, with all the resources we have out there, that you can do this on your own.
Yeah.
It's true.
It's not hopeless. In fact, this is a path to wellness, even if, you know, no matter what's wrong with you.
Right. It's anything but hopeless. There's so much hope. And, you know, I want to correct you. I don't want to correct you. I want to just add that even with physical problems, even with permanent nerve damage, and permanent nerve damage means there's no feeling. So there should be no pain there. I was talking to someone today. Wait a minute. If there's damage, but there's a constant way around this. And I'm not talking about like new age way around it. Even with chronic pain, God forbid cancer, autoimmune disease, people are getting better. People are responding differently to themselves. They're accepting themselves. They're dealing with their anger, and they're finding themselves with a quality of life with a condition. And that's the beauty of this work, with or without, you know, it's just the beauty of it.
Yeah. Doug, thank you so much. It's just been wonderful. And I love how you've actually made it sort of like a whole you've given patients or viewers, whatever, a whole picture of how life can be lived in peace without chronic pain. So
Absolutely.
thank you for that.
Well, thank you to both of you for doing this. This is such a great thing that you have this resource for people that, like me, even if there was no one watching, it'd be fun to just sit and talk with other people that do this. So I've really enjoyed it.
Terrific. And I send people to your Facebook page if they want any information. Somebody wanted some practitioners in Rochester, New York, and I said to email me, and I'll give them your email.
I've got a guy I could give you right now, one of my students who's got a private practice. His name's Jay Natoli. He's in our area. So that person, if you look him up, Nittoli, check him out online, and he can see you remotely. Jay is great. Jay, Jay, Natoli.
Oops.
Yeah.
1 second. Hold on. J A-Y Touli. Toule.
Nit. N is in Nancy. Nittoli. If she checks him out, should work.
Now, before we sign off, anyone who's watching and wants to comment or wants any information, just continue. I'll spend an hour or two this morning going through these questions and trying to answer anything that's there, if I can, or responding to a comment. So I will be online for a little while. And also anyone who wants to email me or PM me or whatever.
Super.
And I'll be available.
I'd also like to say that it's my dream to want to do this forever with Rose. So will you come back, Doug?
Oh, absolutely. This is a lot of fun. We can talk without everybody watching. This is just fun.
Will you come back? I want you to. No, honestly, I see this as I see it unfolding, and there'll be a place for you. Like Rose and I have, there's a place.
TMS roundtable.
Yeah, like there's a place for you.
Save a chair for me at the table. Absolutely.
Good. Excellent. Okay, so we'll see you again soon. We thank you so much. You're an amazing guest. You bring out the best in Rose and I. And Rose, I love you, my dear. Have a wonderful day. I'm going to bed. Have a great afternoon, Doug, and we'll be in touch.
All right.
Okay.
Thank you. Bye-bye.
Bye, everybody.
Bye.